One of the more common questions we're asked on a daily basis is why can't we clean our pets' teeth while they're awake? So I'm going to take the time today to tell you what's involved with a complete dental prophylaxis or dental cleaning. There are some patients that we can't even examine their mouths while they're awake, let alone clean them. Sometimes you'll see the groomers cleaning their teeth, but what they're actually doing is brushing their teeth. Let's get started. The first thing we do is place an intravenous catheter and start IV fluids at a calculated rate. This allows us to keep our patient hydrated throughout the procedure and maintain blood pressure. When they receive IV fluids, they utilize the anesthesia more efficiently and have a smoother recovery. Most important, if there were to be an emergency, this is the direct route if we needed to administer emergency drugs. Next, we obtain pre-surgical blood work. We perform a complete blood cell count, which checks hydration and blood cell function, as well as a platelet count. We also analyze blood chemistry, which looks at kidney and liver function, as well as blood proteins and glucose level. We also run a urinalysis, which will show a kidney problem before it will show up in the blood, as well as look for any signs of a urinary tract infection. All this is to confirm that your pet is a healthy candidate for anesthesia. Once we are clear for anesthesia, we inject our pre-med into the muscle. The purpose of the pre-med is to begin the sedation process, decrease the stress to the animal, and decreases the amount of anesthesia we need to use during the procedure. The pre-med also contains a pain medication, therefore we have a smoother recovery after the procedure is done. We wait approximately 10 to 15 minutes and move to the dental area where we will start our anesthesia. We use our IV catheter to give our anesthetic induction drugs. As soon as our patient is asleep, we place an endotracheal tube. This is the tube your pet will breathe through during the procedure. They will breathe a combination of isoflurane and inhalant anesthesia and oxygen. We inflate the cuff of the tube just enough that there is no leakage around the tube, so no fluids from the dental procedure can be aspirated into the lungs. We hook the patient up to the anesthesia machine and prepare to start cleaning the teeth. Every patient is very closely monitored throughout the anesthesia. We monitor the pulse, oxygenation, blood pressure, temperature, carbon dioxide, and EKG. This allows us to foresee a problem before it can happen. We take pictures of both sides of the teeth before we start so that we can see our progress when the teeth are cleaned. Our licensed veterinary technicians use an ultrasonic scaler to clean the plaque and tartar off the teeth on one side at a time. Because we are using an ultrasonic scaler, we can only clean each tooth for 10 seconds at a time to prevent overheating, so we keep the scaler moving and come back to an unfinished tooth until all the teeth are completely clean. We then move to the other side of the mouth and do the same. Once the teeth are cleaned, the doctor examines the mouth and probes the gum line, looking for pockets which could indicate decay or other abnormalities, which we note on a dental chart. If we suspect dental disease, we will then x-ray the teeth to look for any disease of the teeth or surrounding bone and determine if the tooth needs to be extracted. Extractions are performed by our doctor. Once the teeth are cleaned, we then polish the teeth to prevent the bacteria from collecting in the microscopic grooves created by the cleaning. We need to polish both sides of every tooth. We then take a post picture of the teeth to show the before and after cleaning. Once we are through with the dental procedure and the anesthesia is turned off, your pet will breathe oxygen to speed the recovery as the patient becomes more alert. We deflate the cuff and prepare to extubate or remove the breathing tube. Once the patient swallows 3 times, we pull the endotracheal tube. We then monitor the patient as he recovers until he is awake and standing. Once the teeth are cleaned like this, you can start brushing their teeth daily to prevent the tartar from building back up. Most of our pets can benefit from the professional cleaning under anesthesia every 1 to 3 years. By doing this regularly, you can prevent periodontal disease and tooth extractions, which prevents suffering and saves yourself a lot of money in the long run. Thank you so much for taking the time to learn about our dental procedure. To schedule your pet dental exam, call us at the Ballston Spa Veterinary Clinic at 518-885-5650.